just want to say, Pete, you really should be proud of what you're doing here. We just took this tour of this amazing facility, and the notion that people can come in from the community and get such an extraordinary range of care under one roof. You can literally have a family come in. They need a physical checkup, if they need dental care, they need mental health services, can all be taken care of under one roof. Different members of the family can all be served at the same time. I mean, this is an amazing, amazing center, and it's going to make a profound impact on the health care of the people of the Bronx. And it's going to help people not have to go to the emergency room and seek urgent care because they can get the primary and preventative care they need here. So this is a very big deal. This is the kind of thing we want to see a lot more of all over New York City. I want to thank you, Pete. I want to thank everyone who helped to make this center possible. Really appreciate the great efforts of you and your team. And it is a great day for the Bronx, the Damien Family Care Center. Again, it's a different model. This is the kind of thing we want to see more of, and the fact that this is going to provide for 10,000 community residents, and we're saying at least 100,000 visits, right? 10,000 community residents will be served each year, 100,000 visits or more each year. This center will be a real difference maker. We just took a tour, as I said. I've seen very few places like this where everything can be achieved under one roof. I want to just say, and if my wife Charlene were here, she would say a particular appreciation to the folks at Damien that they included mental health services. And that includes not only psychiatric services for adults, but for children as well. And a lot of what Charlene is trying to do with the Thrive NYC plan is focus on the mental health needs of our children, reach our young people, and address these issues early. And that can happen here at Damien. I mentioned 10,000 folks, and that includes children who go to the nearby public schools. There's 2 public schools right next door. There's 3 public housing developments right around this center. So that means much higher quality care for folks who live right here and for kids who go to school right here. Also, so important to say, we believe that everyone needs care, regardless of documentation status, regardless of ability to pay or what type of insurance they have. And Pete, thank you for holding to that standard. This is a place where anyone can come in and know they'll get care. I want to thank some folks who have been key in making this possible. Someone who I have literally worked with for over 30 years now. Where are you, Louise? Louise Cohen, CEO of Primary Care Development Corporation. 30+ years we've been working together. You wouldn't know it. No. All right. And Suzanne Rousel, Senior Vice President at Community Healthcare Association of New York State. We thank you very, very much for your support for this initiative. We talked about this center in particular during the State of the City address in February, that this would be one of the first to open and would be an example of a new and different kind of care. And we believe that this is one of the ways that we address inequality. Inequality takes many, many forms. One of the most damaging forms of inequality is unequal access to health care. One of the ways you address that is to make it easier for people to access health care and to make sure that no one is discriminated against on the basis of the ability to pay. This kind of model we think is going to be key in our efforts to address inequality, not only because it's more fairness and equality in the healthcare services, but it's also going to make it easier for kids to stay healthy so they can go to school, for families to stay healthy so folks who are working can keep their jobs and thrive. So we know that there are real severe challenges in this community. We talked with Pete earlier about the challenge of asthma. We talked about the challenge of diabetes, the particular impact that has on our children. We know of the 62 counties of New York State, the Bronx, unfortunately, has the worst healthcare indicators. We know we're going to have to invest to turn that around. Again, the goal is to reach people early, to address problems preventatively, to not end up with lots of folks in the emergency room when a problem has gotten really bad. And these kind of clinics are so easy to use. You could tell coming in the door, it's just an easy, positive experience. It's going to encourage people to access health care. This is what we were talking about in the State of the City address, about the need to create a different model and make it available in places like the Bronx. We will continue with our efforts to also create parity. I mentioned how important the mental health piece is. we want in everything we do to send the message about the parity between mental health services and physical health services. There's still, as Charlene has talked about a lot, there's a stigma we have to break down. We want the families walking in the door here at Damien to have the message received that it is absolutely right and appropriate to seek whatever help you need. There's no problem, there's no stigma, there's no difference. If you happen to have a mental health need, it's the same as Charlene always says, if you broke your leg, no one questions that you need to go to the doctor. Well, the same is true with mental health services. And a place that's warm and inviting helps to send that message of parity. We're very, very focused on that. This is part of a $20 million five-borough initiative to create or expand 16 community health centers in underserved neighborhoods by the end of next year. And this center, as I said, is going to be able to reach 10,000 patients per year. The overall plan is to reach over 100,000 patients and to bring a lot of new patients in who currently are not getting care. So that larger plan is to reach a lot of folks who are going without that primary and preventive care, again, sadly ending up in the emergency room too often. We're going to hear from Robin DeCiso in a minute, and she's going to talk about what this kind of healthcare means to her, what it means to be able to access it so easily. She lives here in the community. She's going to give you a view from the grassroots of what this is going to mean for people in the community. But I have to tell you, we know the multiplier effect is going to be amazing. We know this is the kind of investment that we'll look back on and know was the right thing to do because it's going to help improve people's lives in so many ways and, again, create opportunity. When people are healthy, they can pursue their opportunities, their goals, their potential, and that's our job, to help make sure people are healthy from the beginning. A few words in Spanish. Hoy celebramos la apertura del Centro de Salud Damien en Mott Haven. Este Centro de Salud trae servicios muy necesarios a más de 10,000 residentes de nuestra ciudad. Es parte del compromiso que hicimos en One NYC de asegurar que todos los neoyorquinos tengan acceso a un cuidado de salud de calidad y al alcance de todos los vecinos. With that, it's my particular pleasure to bring forward Robin DeCiso so you can hear what it means to her to have health care available right here in her community. Robin.
Thank you. Good afternoon, Mayor de Blasio, members of the community, staff. My name is Robin DeCiso. I've been I've been a patient of this facility for several years. I've witnessed the changes, and it continues to improve. Since Damien Family Center has come about, we've been able to not only have doctors, we have doctors that care. We have doctors now that they communicate with each other. They let it be known, I'm one that I personally see more than one doctor here for more than one ailment. And as a result of that, the doctors are communicating with each other. And I don't have to worry about, do he know what's going on with me? Does she know what's going on with me? They have team meetings, and even if it's not considered team meeting, that's what it amounts to. Here at Damien Family Center, they let me know that I'm a person, not just a chart. It's not just about, oh, this is what's wrong, okay, see you later, bye. They let me know that they care. They sit there with me, not 5-10 minutes, and I got to get out. They sit there with me if it takes a half an hour, if it takes 45 minutes. The blessings of Damien facility is that it's now going to offer different things such as GYN, women's health. It's going to have services for children. We have a number of children within this area that need health care, not only physical health, but mental health, okay? And a lot of the parents, they don't know where to go. So this would not only be a great opportunity for me personally, for the neighborhood. I can honestly say I've been in this neighborhood 30 years, so I've watched it too. You know, I'm fortunate enough to see how could I say it, the blessings, how it's blooming, how it's growing, how it's changing, and it's developing. Mayor de Blasio, I gotta say thank you to you, because you took the time to come into the South Bronx and let us know that we matter. You're the first mayor to do it. Thank you. Thank you very much. I have to say that. With that, everybody, have a blessed day.
Thank you, Robin, so much. You are a positive person, Robin. Yes. Let's give Robin a round of applause. Thank you. Beautifully said. Well, now, in all we do at the city, we have a tremendous partnership between the mayor's office and the city council. And I know Speaker Melissa Mark Viverito is entirely focused on how we address inequality and how we end disparities in healthcare and in so many other areas. And she represents this community as the council member as well, and understands the years of neglect that we have to overcome. And this is part of how we do it. It's my honor to introduce the Speaker of the City Council, Melissa Mark Viverito. And get the floor there.
Thank you, Mayor de Blasio. I won't take too much time. It really is a really great day to see this facility expand. And I think as we were getting the walkthrough, I think Robin kind of alluded to this, right? The clinic that was here before Damien was a for-profit clinic. So the quality of the care, I think you were alluding to it, Robin, is very different than the care that you're receiving here at Damien, which is a non-profit organization providing quality care in a facility that is 30,000 square feet, that has a varied array of services, medical services, for the communities and for the residents here in the South Bronx. I represent this district here, and in East Harlem we have by far the most public housing in the city of New York. It is a low-income neighborhood, but that does not mean that they should be deprived or denied quality healthcare services, right? So to be in this space, what we're really promoting is a healthy lifestyle. What we're promoting is preventive care, right? People's interaction with the medical system shouldn't be in the emergency room when you have an issue that maybe cannot be addressed correctly. We need to really encourage our families and members of our community to look at preventive care, which is what this federally qualified health care center does encourage, that there's follow-up and attention paid, that the child is getting mental health services or dental health care services that they need, while the mother is getting her GYN services, right? This is really a great facility. So I'm really glad and thank the mayor as well for that commitment and that investment in communities like here in the South Bronx that really need, right, quality services and that are entitled to it as well. So I just wanted to come by and express my appreciation for, on behalf of my constituents. It really means a lot to me personally that we're seeing a change in philosophy that this administration, in partnership with the council, is providing, that everyone in this city is to be treated fairly and equitably, and it really makes my job really rewarding. So thank you, Mr. Mayor. Es importante reconocer que aquí tenemos un centro médico que está promoviendo servicios preventivos, ¿no? Aquí las personas que vienen buscando servicios están recibiendo no solamente tratamiento de si tienen un problema con asma, las mujeres pueden recibir los servicios que ellas necesiten. Es un estilo que promueve servicios preventivos para que la gente no tenga que utilizar el salón de emergencia en un hospital como su primera interacción con el sistema médico. Así que un día bien importante, una inversión de $20 millones que ha dicho el alcalde, y me alegro que esté pasando aquí en mi vecindario. Así que muchas gracias.
Muchas gracias. Thank you, Speaker. And now it's my pleasure to introduce a very proud daughter of the Bronx. I don't know, you have to tell us exactly where you grew up in comparison to where we are this moment, but a very proud daughter of the Bronx who has spent her life on the front lines of the fight for public health all over this country, and now is bringing her tremendous talents here to her native land. Dr. Herminia Blasio, Deputy Mayor for Health and Human Services. Bronx homecoming.
Yep. Good afternoon, everybody. Thank you, Mayor. Thank you, Speaker, for welcoming me here. Thank you, Peter, for setting up and running this tremendous organization. Thank you for your comments about what it means to receive caring care. It is, in fact, with great pride that I am back here and great joy and great love in the Bronx. So the geographic question, I grew up north of here, 6 blocks east of the Grand Concourse. Not that I counted them every time I had to walk to the D train. 6 blocks east of the Grand Concourse, around 170th Street and Clay Avenue. Born and raised, so the Bronx really is my home. Born in the now no longer existent Bronx Hospital, so you could not become more of a Bronxite than that. And it is here in the Bronx that I became inspired to pursue a career in medicine and public health. And as a physician, as a clinician, I've seen firsthand the importance of that local health centers play in our communities and in communities across the city and indeed the nation. This new health center, as you've heard, will serve an additional 10,000 members of our neighbors. It will provide important services for our adults and children, including behavioral health services, and these services will be provided regardless of immigration status, regardless of insurance status, regardless of ability to pay. And thanks to Mayor de Blasio, we are seeing the work that today will be replicated across all 5 boroughs. The administration has made a commitment to delivering community health centers to communities in need, and this administration is delivering on that promise. We know that good health comes from healthy communities, and this is one aspect of a healthy community. But health happens largely, not just in the context of a wonderful health center like this. It happens where we live, learn, work, and play. And I'm not sure Mayor de Blasio recognizes how much of a public health practitioner he has really been, because in spurring on early childhood education and good paying jobs and affordable housing, those are all things that change the conditions where we live, learn, work, and play and help build healthy communities. So I am very proud to stand here with Mayor de Blasio, the Damien Family Health Center staff, and Speaker Mark Verito, and President Torres Springer. Most importantly, I'm very happy to be here in my hometown in the Bronx. Me siento muy orgullosa de estar aquí en mi condado, en mi casa, en el Bronx. Fue aquí donde me inspiré a seguir una carrera de la medicina y de la salud pública. Como doctora, yo he visto de primera mano la importancia de los centros de salud locales en nuestra comunidad. Además, ofrecerá importantes servicios este centro de salud para adultos y niños, incluyendo servicios para la salud mental. Estos servicios se prestarán independientemente a estado migratorio, si tiene seguro médico o capacidad de pago. Gracias al alcalde por la labor que estamos viendo hoy día aquí en el Bronx se replicará a través de los 5 condados. Esta administración se comprometió a la entrega de centros de salud en la comunidad para barrios más necesitados y estamos cumpliendo con nuestra promesa. Gracias, alcalde.
Muchas gracias. Finally, I'd like you to hear from the person who helped make all the money flow and all the work happen so that we could realize this day. The President and CEO of the New York City Economic Development Corporation, Maria Torres Springer.
Thank you, Mayor. Good afternoon, everyone. My name is Maria Torres Springer. I'm the president of the New York City Economic Development Corporation. It's a real pleasure to be here today to help open this new family health care center. As Peter mentioned earlier, we certainly believe that access to health care, it's a fundamental right of every New Yorker and is also a very essential part of what we're trying to do across the 5 boroughs, which is to create vibrant, healthy, equitable communities. And that's why our Community Healthcare Center expansion program, of which this is part, is supporting the creation of new health centers in New York City fulfilling the mayor's pledge to provide much-needed care to underserved communities across the 5 boroughs. What's really profound here, I believe, is that not only are we working to improve community health, but we're also creating quality jobs for New Yorkers in their own neighborhoods. Damien currently employs about 166 New Yorkers at their various sites across the city. But what we're excited about is that through this particular project, they are not only preserving 60 staff positions here at this location, but they'll also be able to add additional jobs, at least 5, and that I'm sure will be more. And on top of that, there's more. They're also increasing the wages and the benefits and the job quality for the employees who are here, many of whom we met earlier. And we think that's tremendous, a way to think about what economic development means, what economic opportunity means on so many levels. And we know with our continued partnership with them that they're going to be a tremendous success and is something that is for sure to be replicated throughout the 5 boroughs. The mayor mentioned earlier, and Peter as well, that what we're providing here, it's not just one type of service, it's truly comprehensive. The facility will provide primary, dental, child and adult behavioral health care, specialty services, even an on-site pharmacy. And what that all means is that we're providing an opportunity here for Bronx residents, for New Yorkers, to have the right care at the right facility with the right doctor. And that for us is an investment that we have to make in the families, in the communities of our city. We wouldn't have gotten here, of course, without the support of so many in this room, our colleagues and partners at the City Council, other local elected officials, the tremendous team at Damien Family Healthcare, and the wonderful team at EDC, Sharyar Khan, Marina Kaneko, and Michelle Anand, who I'd just like to give a shout out to personally, who've worked tirelessly to make sure this day has come. And we think this is just the beginning. As the mayor mentioned, there was a goal of 16 sites by the 2017. We are going to surpass that. And working with our colleagues at Health and at HHC, we believe we will get to over 20 sites by the end of 2017. And so that, again, is tremendous, not just for the health of different communities, but really in terms of making sure that we are uplifting families and creating economic opportunity for all New Yorkers. Thank you very much.
Thank you. Thank you, everyone. Good. Thanks very much. Help us